Thank you, everybody, for joining. My name is Josh Pade. Uh, I am a Democratic candidate for Congress here in the 1st Congressional District. And I'm so glad you could all join us tonight for our this is the first virtual town hall using this format. So thank you all for joining. This will be broadcast later, so you can watch it on Facebook, and I think we'll actually put it on YouTube as well. Want to make an introduction. So glad we are joined here by Greg Winkler. Greg, thank you for joining. He comes to us from Rock County. He's the, excuse me, the head of, I'll let you go into more what you do with human services there in Rock County, but you work with behavioral health, a number of other issues, and I want to talk to you about healthcare, talk to you about COVID, talk to you about maybe some of the things that aren't getting talked about in the news, but are affecting people in their lives. So, Greg, why don't you give us a quick introduction?
Okay, thanks, Josh, for having me. I am the Deputy Director at Rock County Human Services Department. I've been here for about 7 years in a leadership position. I've been a social worker for 30 years, mostly involved in clinical practice, behavioral health programming, some social work regulation stuff. At Human Services, I'll tell you what Human Services does so you get a sense about the perspective that I'm coming from today. We work with kids and adults who have complex needs. These are often folks who are not able to get services in the private sector because of a lack of resources, or the complexity of their situation is such that the private sector has a hard time managing that. So, you know, as our discussion moves forward, I'll be sharing information largely from that perspective, but try to broaden it some also. So that's me.
Thank you, Greg. So yeah, let's kind of dive in. You know, healthcare has become front and center because of COVID, because people just, the normal places where they get care, they can't get it in the normal way because it has changed the way we interact with each other on every level, whether it's education or healthcare or families. Gosh, my wife and I went to a funeral on Zoom just a couple months ago. It's really changed the way we interact with people. Greg, what do you think are the most important or most pressing behavioral health challenges that we're seeing right now in the area?
Yeah. So let me, if you don't mind, like if I can take a minute just to talk about what behavioral health is so that we're all on the same page about that, and then talk about some of the challenges that we always see and some of the challenges that COVID presents. Behavioral health, let me also say that I'm like super excited to be the only guy on a healthcare conversation, and we're going to talk about behavioral health. This is not a normal thing. So I appreciate that. Behavioral health is a very critical part, like of all of our lives. It has to do with emotional wellness and resilience and supportive relationships and, you know, coping skills and people's ability to navigate the normal stresses of life. And when that doesn't go well, a lot of things are affected. I think that from a healthcare perspective, behavioral health, people think about it as mental health treatment, addiction treatment, psychiatry. Those kinds of services are what constitute the behavioral healthcare system. And those services can happen in an outpatient clinic, in an inpatient unit in a hospital, in a residential treatment center, a lot of different settings. But we're talking about the kind of treatment that focuses on people's mental health and addiction and that type of stuff. So that's really what behavioral health encompasses. We historically see challenges in behavioral health related to access to care, related to stigma around mental health issues, related to coordination of care. I can say a few things about each of those. Access to care, you know, when that's going perfectly, access to care means that if I identify that I have a concern and I call someone or I find a place to go and I get in a reasonable amount of time, and that sounds simple, but there's a lot of ways that that doesn't always go well. Some of the barriers there have to do with funding, and there's rules around insurance and other kinds of things that don't make it quite so easy to just call the place that you think you should call. Sometimes people aren't aware even that the problem that they have, that there are services that they can seek out to address that problem. Sometimes there's a wait list and services are not readily available, or people have to wait sometimes weeks or months, we're talking about, for some of these services. Sometimes people are afraid. It's very frightening to like go to your first appointment and not know what to expect and think you're going to be asked all these personal questions. So a lot of things that go into this access to care issue. Stigma, which I'll say is my second challenge in the behavioral health world, is really just people viewing mental health issues in a generally in a negative way, both others viewing you that way and perhaps you viewing yourself that way, believing that you're judgmental or weak, and having kind of these personal attitudes related to what behavioral health care is, and you know, I should be able to pull myself up by the bootstraps and all these kinds of things. And that certainly can get in the way of people getting the care that would be helpful to them. The last thing I want to talk about is coordination of care, which is essentially how information is shared. An example might be that if somebody calls for help and they simply are provided with a phone number and told, call that number and ask for help, that's that sounds simple, but that often breaks down. And what we find that we need is to like really help people navigate the system and help them explain what they need, and provide a lot more support when we're trying to connect people from one agency to another or one service to another. So these are all things that we're constantly working on here at Rock County, and a lot of people around the state and the country are working on improving those things. But these are typical barriers and challenges in the behavioral health world. You included COVID, Josh, in your question. I can just sort of jump to that now if you want me to.
Yeah, that'd be great. That was going to be my follow-up, is how has
Okay.
COVID made, so have you seen how has it exacerbated behavioral health issues people are dealing with? I know
Yeah.
just from people, both anecdotally and things that we've seen in the news, that whether it's addiction issues or other, people are just dealing with anxiety of being at home, being alone. Many people don't have a large support system. So whatever issues they were dealing with become much worse. So, you can speak more to that. And then on the provider side, how has COVID impacted the way you're able to provide services to people that need help?
Yeah. So we have COVID. So we all know this, but we have COVID, and we have racial tensions in our country and around the world, and we have the political climate, and these things all lead to different but similar kind of stresses for people. So clearly, COVID has created increased isolation of people, fear of contagion, catching the disease, anxiety about the future. How long is this going to last? We have all these school questions happening now, and it's just like the whole world's been thrown up in the air. And that's hard for all of us. For people that may have already been struggling with anxiety or depression or various mental health issues, this can have a pretty devastating impact. And so we have seen that suicides have gone up a bit. Addiction, use of drugs has gone up. Overdosing on drugs, opiates in particular, has increased. So these were already problems that we had, and we're seeing them get worse, which makes sense, right? You add all this stress, and things like that are going to get worse, and unemployment, loss of income, housing issues, all of this has gotten worse, and there's this domino effect that hurts people. And so interestingly, from a provider perspective, so this all happened in March, and very quickly, we and many other industries had to shift. What I mean quickly, I mean within a matter of days. Here we have a workforce of 400 plus people, and within days, those people shifted from their office to their home, which is a monumental task that we probably would have said that we couldn't have accomplished. But then when you have to accomplish it, we did it. And largely, with some exceptions, most of our folks are still working from home. And much to our surprise, actually, work has continued, not in exactly the same way, but we continue to serve the clients that we were serving, and the vast majority of that is the same way that we're having this meeting right now, through Zoom. And we, for the first couple of months, things seemed oddly calm and quiet. And what I mean by that is that we get calls through a crisis intervention line, and we have other services and people enrolled in treatment, and things like oddly seem to be going okay, just from a client's perspective. And then maybe 2 months ago, something happened, and we saw like a lot more need in the community coming our way. And what I mean by that is a lot more calls. So we have the role of helping people get into hospitalization sometimes when they have behaviors that aren't safe. That kind of all of a sudden went up a month or two ago, and so I don't really know exactly what that's about. Although, at some point we all started to realize that this is not a short thing. It's going to be a long thing, COVID. And so perhaps that just was very stressful for people. I don't know. But so from the provider perspective, that's kind of been where we're at. And now we're kind of settling in and saying, like, we're going to have to do this. This is business as normal now for the foreseeable future. And so we're figuring out how to do this. One other thing I'll say from a provider perspective is telehealth. So we started very quickly to start providing treatment and other services through Zoom and other video formats. And it was a bit challenging at first, but we have found that it works better for some people, not everybody, but we have been able to engage, some of the folks that we work with don't necessarily like the intimacy of an in-person conversation about personal things, and working through Zoom has been helpful. And like some kids who have been difficult to engage have been easier to engage through this kind of video format. So there's been some interesting, I guess I'll say positive things. In a sea of a lot of challenges, there's been a couple of things like that have been surprising and helpful.
Have you heard? So, I mean, I've had a couple telemedicine appointments myself. Have you seen any people hesitant to get care because of the telemedicine aspect of it, or maybe personal technology deficiencies they may have, whether it's their internet connection or their computer, like whatever technical tools they have, they don't have a good computer, good internet service.
Yeah.
Does that prohibit them from getting care? Are there tools they can use, they can reach out to in that event if they don't have access to that?
We have had some of those issues. We have bought track phones at Walmart, honestly, and some minutes, and those are not very expensive. And so people that really need to be in touch with us and don't have a way to do that, we have bought phones for some people, which has been super helpful. It hasn't been a ton of people. We're 5 or 10 of those, but we've done things like that. We have about 1,000 people that we're treating at any particular moment in time, and so we already had a lot of clients who had ongoing appointments. So those continued almost uninterrupted. And then we also have new people calling for help. And in those cases, it's a little bit of an adjustment, but for the people that already knew us, it was much smoother, because they all understood what we needed to do. And it honestly, like, I never would have predicted that it would have gone this smoothly, but people really banded together and said, okay, like us and clients and the community, and we're going to make this work somehow.
That's great. How do you see behavioral health kind of overlapping with other aspects of healthcare? Both, you mentioned some people have to get to a hospital. A lot of hospitals have been strained because of COVID. I personally have a family member who works in psychiatric. He's a psychiatric nurse, and he actually got transferred. I mean, it was a volunteer situation, but he went to go work for a hospital that was having a surge of coronavirus patients. Do you find that people that there's a strain on the system, or just what is the relationship between people that have physical problems that could move into behavioral health issues that need to get.
Yeah, yeah. Well, I'll answer that hospitalization question first. We have had a network of psychiatric hospitals and or psychiatric units in general hospitals that we have worked with for years, and we continue to do more or less the same thing. And so we have not really had any different experience with getting people into psychiatric hospitals. We've provided them with transportation, and we've learned a lot about PPE in the last few months, and we know how to use all that stuff. And so that's gone surprisingly not too much different than it normally has. What we have found sometimes is that people sometimes want, so like if somebody's coming out of the hospital and going to some other like lower level of care residential facility, or they're going into a hospital, people want COVID tests before they go in.
Mm-hmm.
And so that's added a little bit of a barrier because a COVID test is not always easy to get, and because some people don't want to have the test. It's been a little bit of a problem, but not as much as you might think it could be. And I haven't heard your story about the psychiatric people sort of shifting to COVID units. That I haven't heard any of that has affected any of the places that we work with. And then the other part of that question about behavioral health related to medical care. This is getting better, but historically, behavioral health and medical care have been kind of a bifurcated system, located in separate locations. The whole funding system is set up quite differently, like they're just separate parts of an insurance policy. Like everything about it has been separate, which is really not in any of our best interests. And because we know that behavioral health things like depression and anxiety and chronic anger and various things like that are very related to medical conditions. Like the more behavioral health concerns that you have, the more likely you're likely to have medical problems, and vice versa. And so it's really extremely helpful to like address all of that at the same time if you can. And so the concept now is called integrated care, where more and more people are putting behavioral health services and providers inside of medical clinics and partnering more with the primary care staff. Likewise, primary care staff are getting more training and more knowledgeable, and maybe a bit more comfortable working with into the primary care office and talking about depression and anxiety. So this should be seamless. Like in an ideal world, behavioral health and medical care should be seamless. That's a high standard, but that's the best practice. And while we have a long way to go, that there has been some movement in that direction.
And then, have you noticed any? Obviously, there's been issues with domestic violence or people that are in a situation at home that maybe isn't the best. Best ways for people like that, people in that situation, to be able to get care. Best ways to prevent a situation from becoming a dangerous situation. What have you seen? What are some best practices people should know about?
Yeah, that's a really good question, Josh. I'm not sure I have the most satisfying answer in the world. Our child abuse reports are down, domestic violence calls are down. This may have changed, but as of a month, 6 weeks ago, that was still the case. And I don't know that we absolutely know why that is, but the suspicion is that a lot of those child abuse calls came from schools and other places, and domestic violence concerns were often raised by people coming to the emergency room with an injury or other friends and family reporting. And with the isolation that we've seen with COVID, perhaps whatever might be going on in various households is not as visible to the outside world because we're just not interacting so much. That's the sort of the theory that people have about this. I don't have any like specific situations that I've heard about, other than just knowing that some of those what we would typically see in some of those reports has been decreased. So it's a little bit alarming, I guess. Like what does the future hold in those
Yeah.
respects? Yeah.
So, kind of thinking broader, what are some, and we can put this then in the chat and on Facebook, resources that people can have either for themselves, for people they know. We did just talk about reporting. If someone believes that someone has a behavioral health issue or domestic violence issue, how can they report that
Yeah.
safely? And then what are some resources for people that want to get care?
Yeah, well, those are also great questions. I will follow up with additional information because I'm not sure the geographic breadth of who we're talking to here. So I'm in Rock County, but maybe what might be more helpful to this audience is some state or national hotline numbers and places that you can call for that sort of thing. And so there's suicide hotlines, there's a text line, there are addiction hotlines. I'm not if that's the kind of thing that you're talking about. But then, like at a more local level, there's treatment facilities, and we have an intake line here at Rock County, which is 757-5225. If you live in Rock County, you can call that number and request help. We have a crisis intervention line here, which is 757-5025. Um, so that, let me follow up with you and get you some like a sheet that's going to have something more helpful and detailed than what I just said.
Thanks, Greg. And then we'll also add kind of your counterpart, the information for Kenosha, Racine, Walworth, and then the district goes into a little bit of Milwaukee and Waukesha County. So we'll add those as well. So people can have the resources they need and can share the resources to other folks. Yeah, we did get a question. Someone just saw the news today about the New York Attorney General going after the NRA, but had a broader question, just, threats of violence. We just kind of talked about that a little bit about, people are worried about people at home having access to weapons. And I think we just talked about that it's a concern. And, without having the kind of normal mechanisms and institutions that can spot someone who's at risk for themselves or for other people, it's difficult. It requires a little bit more vigilance by all of us as citizens, as neighbors.
Yep.
Look out.
Yep. So, without getting into the whole NRA gun rights issue, I will say this: like firearms are the most deadly thing there are, and that's when people attempt suicide in various ways, and when they use a gun, they're most likely to be successful, which probably sounds obvious, but there's tends to be ready access to guns. Obviously, some people are more responsible about securing them and that type of thing, but it can be dangerous if there's somebody that is suicidal or especially angry or impulsive and has firearms readily available. That's been a problem often.
Mm-hmm. Yeah, it can be a problem. And like we've been talking, that we can have red flags, but you have to be able to report those red flags and see them. And isolation is a big factor in this. And being able to effectively coordinate between behavioral health and physical health, and as much of a social circles that we can maintain here during COVID is a challenge for all of us as good neighbors. Someone said, do you see any immediate solutions to some of the issues? So yeah, if there was some like big challenges that could be fixed, if you were king for a day or however you want to put it, you could check one or two things that you could fix, what would be the biggest top of mind issue you would work on?
Well, I don't have like a soundbite answer for that, but what we're doing here in Rock County is we're working on making our system more efficient and more streamlined, so that when somebody calls, they get what they need without being transferred. And like, I know that sounds small, but those are significant. Think about when you call somebody, and then think about like being at a desperate point in your life. Like, you don't need to be moved around from person to person. Like, you need somebody to help you. And so things like that, we are involved in some efforts in the community regarding integrating behavioral health and medical care together. So uh, a lot of people say we need more money, we need more staff, and I'm not saying that we don't need more money or need more staff, but I think that there's ways for us to be smarter with the money and staff that we have. And what I mean by that is, like, work with the people. We try very hard to work with the people that we that are in our business in Rock County, and it's amazing what you can do by forming relationships with people and getting to know them and learning how they do business and how we do business, and things flow better. So, like, that's like a really wishy-washy social worker-y kind of an answer, but that's the truth about a lot of how we're trying to handle this. We've added some prevention. We have added a prevention position into our department, trying to, like, think upstream a little bit. um, we haven't talked about trauma or ACEs, which are adverse childhood events. That's a whole other thing, but that's a big deal. Like, what happens to people when they're young translates into problems that people have that require our help later. And so to try to address those sooner, um, we're trying to put some resources in that direction also.
Excellent. Um, so if someone's watching and they want to be you, they want to get into social work, they want to be in the behavioral health. What would you recommend? What are some good tips? What would you recommend to people kind of looking to that want to be on the helping side of this?
It's a great career. I would say I have loved it. What should they do? You can, depending on where you're at in your education and your life, you can find a lot of jobs with, working in group homes with people, or kind of being um, aides to folks and stuff like that. And then, that's often how people start, and they get interested in this. And then they end up maybe taking a human services associate's degree or a bachelor's degree. And um, you know it's um, it's a great field, and if people feel a passion to help others, I would encourage them to, like, if they're looking for work in that area, call places. I don't like nursing homes, but again, it, like, depends on where you are in your path. And honestly, I would be happy for people to call me if they're interested in a career in social work and how they could get started. Um,
Great. And then the last question I have is, you know, obviously I'm running for a federal position. So, like, is there anything from whether it's Health and Human Services you interact with, or even Badger Care and Medicaid, it kind of intersects federal and state government. Is there anything that you see that could be better from that perspective, or dealing with the bureaucracy that could be improved? That from your perspective you would recommend?
yeah, I think funding issues are really complex. I don't know how to fix that, but Medicare has certain rules and Medicaid has certain rules, and it doesn't pay enough. Behavioral health is not a lucrative profession. I'm not talking for myself. Lucrative business is really what I mean to say.
Mhm.
And so it's difficult to, if you're at a hospital and you're choosing what services to provide, behavioral health does not jump to the top of the list from a investment kind of perspective. So that's important. Um, right now, there are some amazing grants coming out of the federal government, which that is so helpful. Um, and we have applied for and gotten some of those grants to help us with of many things related to COVID: housing, peer specialist services, things we haven't talked about yet. But and I would be happy to talk more with you. There's sort of like some nerdy in the weeds kind of things related to Medicare funding and stuff that I think would be helpful to change. Um, So
So,
I guess, yeah.
I mean, without getting too into the weeds, like what kind of broad strokes particularly within Medicare, on helping folks with mental health. I mean, particularly because I mean, I have some elderly folks in my family who are on Medicare who also deal with behavioral health issues.
Well, so here's like just a little thing. Medicare requires people that provide mental health care. There's a lot of professions like social workers and professional counselors and marriage and family therapists. Medicare will only reimburse social workers,
Mm.
not the other types of mental health professionals. Um, and people, insurance, and in most cases, Medicare and Medicaid don't pay for case management services. So you sit with somebody for an hour to do treatment with them, but then if they need help with housing, or you could spend a fair amount of time like helping people like kind of get the pieces of their life together, which isn't necessarily therapy, which is what we bill for, but you don't get paid for the case management stuff, and because you don't get paid, people aren't able to spend much time doing it because it's essentially volunteer work. um, so it's little things like that have a significant impact on the way that we care for people. Funding really dictates a lot of how the world works, and so those are the kind of things that dictate how people practice. I mean, people are doing a good job, but a business can only do so much when it's trying to provide care to people.
Yeah, I think that that's something that we've seen, particularly with COVID, is how many things in our lives are interdependent.
Yeah.
And housing and employment and healthcare and transportation, all these things, education, schools interact with each other. Childcare, it goes on and on. It's just a living, um, just every aspect of our kind of social fabric are so interdependent that dealing with one means dealing with three other things. And
Yes, that's true.
it's something that we've always kind of talked about it, but really saw that how one thing can interact with everything else because of the pandemic. And
Yep.
addressing these things should be more holistically approached.
Yeah. Yeah, I think that's true. You make a decision, and 10 steps downstream, you don't know what that's going to look like, right? Like, understandably, you can't like predict the impact of every small change that you make, but those are the things that we end up having to deal with.
Mm-hmm. Absolutely. Well, we are going to wrap up. Thank you so much, Greg. I should say we were going to have a doctor on who's also running for assembly, and this is on me. I told her Thursday and then the wrong date. So she's going to be joining us this weekend for one of our other town halls. It's Catherine Kalki. That is just me and mixing dates up because that's happening during this time. But Greg, thank you so much. Thank you for all the information about behavioral health. It's such an important issue. It's something that has been front of mind for all of us with COVID, with having family and friends who are dealing with issues and making certain that they can get the care that they need. And thank you so much for everything you do. I would remind people that we do have an election coming up. So on August 11th, so if you have an absentee ballot, you can drop it off depending on your local municipal clerk for the next couple days, or you can go to the polls on the 11th. Make sure you wear a mask and stay distance and vote for Josh Pade. And Greg, thank you so much. Stay safe, stay healthy. Look forward to that information. We will put that information probably on Facebook or in the chat for folks so they can have access to those resources.
Yeah, that sounds great. Okay, thank you, Josh. Happy to be involved.
Thank you, Greg. Take care.
Okay.